as we're thinking about our first big topic today. So I'm going to be talking to you for the next maybe 30 minutes about the idea of heat and health as it relates to the current climate situation that we're in. So what I want everyone here to learn from this exercise is, first of all, how is climate change affecting temperatures in the Bahamas? What is heat illness? What are heat sensitive conditions and who is vulnerable to them? And lastly, but most importantly, how can we protect our health in the face of extreme heat? So we're going to do some storytelling today. This isn't going to be a boring science talk. This is going to be about stories. This is going to be about people you know, or maybe you don't know, right? But people who are similar to the folks who live in your community. So here's the scenario. The scenario is that it's been over 100 degrees Fahrenheit for the past 4 days. It's been really hot. Nighttime temperatures have been above 90 degrees, so it's not cooling off at night. Hospitals are filling up with patients, and there's power outages spreading because everyone's got their air conditioner running and the grid is blacking out. So I want to introduce you here to Gladys Marcy. Okay, she lives next door to you, let's say. She's 77 years old. She's a grandmother with 8 grandkids. She's got 4 of her own kids, and Gladys had a heart attack about 1 year ago. So she's taken a lot of medications. She's going to the hospital a lot. She lives with her daughter in a top floor apartment in Nassau. And Gladys, she loves to garden, right? So we're in the middle of a heat wave. And what we know from Gladys's daughter is that Gladys was in the apartment all morning. She was pacing around, complaining that she was feeling dizzy. And then in the afternoon, Gladys started to get very confused and she started throwing up. So Gladys's daughter called 911. Paramedics show up. They take Gladys, they bring her to the hospital. And when she gets to the emergency room, she's diagnosed with heat exhaustion. She receives IV fluids and she's cooled with water and fans. And then slowly her confusion starts to resolve. And when Gladys is kind of back to her senses, she wants to know what happened, right? So Gladys had heat illness. And what you can see here is that heat illness exists on a spectrum. What I mean by that is that there's mild heat illness, there's moderate or a little bit of heat illness, then there's severe heat illness. There's the real deal here. So what heat illness is in general is it's when the body is faced with heat, either from the environment or from the heat that's generated from running or working really hard, to a point where we can no longer start is exhaustion, a moderate type of heat illness. This isn't the worst, this isn't the least, this is somewhere in the middle. So symptoms of heat exhaustion are when you get dizzy, lightheaded, when you get a little bit confused or a little bit off, you have a headache, maybe some blurry vision, you're sweating, you're thirsty, you might have a little bit of chest discomfort or some trouble breathing, you might have some muscle cramps, you might start getting sick to your stomach, you might start vomiting, having some nausea, or you might just feel generally weak or fatigued. When someone has heat illness, this is an urgent medical condition. And what that means is that you need to treat it. You need to stop what you're doing and change what's going on, right? Because if you don't treat heat exhaustion, it can progress to a more serious type treatment. See someone with heat exhaustion, you have it, is you first of all, you move them into a cool environment. If they're out in the sun, if they're at a work site or they're just looking bad, you move them into the cool environment. You give them cold water. Maybe you give them a cold rag and you try to cool them. And then you keep an eye on them, right? You check their vital signs. You take a look at how conscious they are, and you make sure that they're improving, because if they're not, you need to seek medical attention urgently. So, you know, when you're telling this to Gladys, she's like, what are you talking about? I'm 77 years old. I've lived in Nassau my entire life. You know, why have I never had an issue? Why just now? And so the reality is that it's been getting hotter, right? So what we're looking at here are global average temperatures from 1880 to the present. So what we're seeing is that it is getting much, much, much hotter, right? Here we are in 2020. The past 10 years have been some of the hottest on record. And then we look at where Gladys was born. Gladys was born at a time when we had pretty stable temperatures, right? She was born before we started feeling these global impacts of climate change. So yeah, of course, Gladys hasn't had a problem yet. And her whole life she's been dealing with heat, she's been fine. But the reality is that the climate is changing. And so we have to change the way we behave in order to make sure that we don't get sick because of this extreme heat that we are experiencing. So we know it's getting hotter on average, right? But the thing that's most important, and this is a little bit of a complicated diagram, so I'll walk you through it. So here we're seeing that the shift in the average is moving. So we're getting higher average temperatures across the globe. But this curve is shifting, but it's also flattening out. So it means that we're getting much more hot weather. As we push down on this curve, the tails spread out. So we're getting extreme temperatures like heat waves that we've never seen before. And that is one of the most important things that we think about when we think about health, because these heat waves are some of the most dangerous things that impact our communities and our patients. So what's going on in the Bahamas? I've been showing you diagrams of world temperatures. What's going on in the Bahamas? Well, it's similar. So back in the 1950s, things were pretty good. And then over the past 30 years, we've been seeing this slow rise in average temperatures in Bahamas. Prediction for yep, that's right. We're going to see it rise. But I want you to focus on different bars, these 3 green bars. These are possibilities. We don't know exactly what's going to happen in the future, because if we may end up with temperatures way up here, we also could end up with temperatures here. We know it's going to rise, but the extent to which it rises is we are here today to talk about, right? It does not have to get this hot. We still have the opportunity to change how hot it's going to get in the future. We know climate change is going to continue to happen, but we still have the opportunity to limit what the future is going to look like in terms of temperatures. And that's really important because we still have opportunities to change the course of what's happening. So now let's go back to Gladys. Her daughter's in the ER, her daughter's panicking. What's going on? She's calling all the family everywhere. And Gladys says, well, if my mom got sick from heat and you're telling me the global temperatures have been changing, why didn't I get sick? Okay. Gladys is 32 years old and she wants to know why she didn't get sick too. So that brings us to this really interesting thing about heat illness, which is that not everybody has the same degree of vulnerability, right? It depends on things like your age. Do you have any existing medical conditions? Are you pregnant? Are you taking any medications? Do you have dementia, or do you have some type of cognitive impairment? Do you have any disabilities? Do you live alone so nobody even recognizes if you're sick? You get it. The other thing we think about are things like exposure, right? How much heat are you being exposed to? For example, do you work in construction, or do you work somewhere where you are just constantly in the heat, right? This could be outdoor heat, or it could be you work in a factory and you're exposed to a lot of heat. And then we think about things like, do you have resources, right? Can you afford air conditioning, or are you living in a state of poverty? We think about other issues such as how have been designed. For example, are all the very wealthy people living in our world, everyone who's packed areas where there's no shade, right? Those are called structural determinants, right? Structural racism. Do you have good social cohesion? Do you have close neighbors? Do you have a close community? What's your housing like? Things like that. So we'll talk about these moving on. But that's our answer to Gladys's daughter's question of why she didn't get sick as well. So let's think about Gladys. What are her susceptibilities, right? Her age, she's 77. As you get older, you don't really have the same ability to cope with heat. It's just a normal part of aging, right? You're not as flexible as that young sapling tree, right? And the wind comes, you don't bend as well, right? Same thing with how our bodies respond. We also know that older folks tend to have a lot of other conditions, right? They've had heart attacks, they've had strokes, maybe they have diabetes, they have other stuff going on. They're more likely to be on medications, and medications can sometimes make you more vulnerable to the heat. They might not kind of have the same wits that they used to when they were younger, right? And they depend on their caregivers. So if Gladys's daughter wasn't there that day, what might have happened? We also think that some older folks aren't able to get around as easily, right? So if they are hot, can they get themselves into a cool place? And many older adults tend to be isolated from their families. So that's why they're more sensitive. Another reason why Gladys was sensitive is because she had a history of heart disease. And I mentioned a few of these before, but this is a list of medical conditions that make people more vulnerable to heat: heart disease, lung disease, kidney disease, diabetes, dementia, and also any substance abuse. So people who use alcohol, cocaine, or any other substances make you more vulnerable to heat. Gladys is also on a lot of medications. She came out of the hospital and the doctor said, okay, you're gonna this. She's on like 10 different medications. She can't name any of them, right? She's on a ton of medications. This slide here is intended for our medical audience here. This is a list of different types of medications and how they may affect an individual's ability to cope with heat. And I'm happy to share that with clinicians in the room who are interested. We need to pay attention to these types of medications because they make our patients more vulnerable. Okay, let's move on to another person who is in a heat wave as well. They're on one of the communities here in the Bahamas. This is a 35-year-old male. He has a history of depression. He works in construction. He drinks alcohol pretty regularly. And he's been struggling with homelessness. He's been staying at friends' houses, staying at family houses, but he doesn't really have a stable place to live. It's been 100 degrees for the past 3 days, and the heat index is 120. We're going to get to what a heat index is in a minute. Marcus has been working outside every day under pressure to complete a project, right? His boss is like, this building here needs to be up in the next 2 months, and everyone is on job site from sun up till sundown, working through the heat of the day. So at 2 p.m., coworkers noticed that Marcus appears to be a little bit more clumsy, right? He's dropping tools, he's kind of slowing down. People are like, Marcus, are you okay? What's going on? Weird, maybe he's drinking, no one really knows. At 4 p.m., his coworkers find him collapsed next to some scaffolding near the building. They can't wake him up. They're shaking him. They're saying, Marcus, come on. He's not waking up. So they call 911. And he's taken to the emergency room and he's diagnosed with heat stroke. The thermometer in his mouth, and they see that his temperature is 41 degrees Celsius or 105.8 degrees Fahrenheit. Okay. So for all of you in the room, that is too hot, okay? So what Marcus had is what we call heat stroke. This is a severe type of heat illness. It's life-threatening. It's because it happens as a result of exposure to really high temperatures. And what we know from about heat stroke is that the way we diagnose it is when someone has a very high core body temperature, they're confused, and they have some trouble breathing. This is heat stroke, and this is a medical emergency. This is a life-threatening condition, okay? Treatment for this is that we need to lower that body temperature within 30 minutes to prevent serious end organ damage, meaning it fries your brain, it fries your organs. So this is a life-threatening condition. So how do we cool some of this quickly? The best way to do it is to have a big bath full of ice water, and you literally put that person's body in the ice. So I don't know how many hospitals or ERs have an ice bath, but not many, right? So what are our other options? Well, we can take all the clothes off the individual. We can, douse them in water. Everyone in the room is talking. We pack them with ice into their armpits, into their groin, their neck area, and you put a fan on them because that helps cool them faster. You also start IVs and you give them cold fluids. So remember, you have 30 minutes to get this core temperature down, which is not a lot of time, okay? Luckily, the doctor and nurse caring for Marcus came to this workshop. and they were trained to understand how to recognize heat stroke, and they knew exactly what to do. So they rapidly cooled Marcus. They got his temperature down in 26 minutes, which was incredible. And slowly over the next few hours, Marcus regained his level of awareness. He did suffer a little bit of a liver injury and a kidney injury. He was hospitalized for 4 days. 2 months later, he still has some trouble with his coordination. He has some memory issues. And he can't work because of these types of issues. So we saved Marcus. This is awesome. But he's not back to exactly where he was. So this is to kind of raise your awareness of just how dangerous heat can be, okay? We don't see this all the time, but when there's a huge heat wave, we do see a ton of this. All right, so what made Marcus vulnerable? What are the things about him? First of all, he has a history of substance use, right? He uses alcohol, he drinks a lot, and he has a history of depression. That puts him at high risk. He's also homeless. So he was at a hot job site all day, home to a nice conditioned home, right? He was staying on a couch somewhere where it was also, so he never had time to cool off. And he works out, makes him incredibly vulnerable. All right, our last patient here today, our last friend I'm going to introduce you to. This is Kiara Paulson. She's 34 years old and she is 30 weeks pregnant. She lives with her partner and she's got 2 children who are 4 and 6. She also lives in a high-rise apartment and she's got no air conditioning in her house. It's been 95 degrees for the past 2 days. It's also been incredibly humid. And something, this is a key term today, the relative humidity has been 80%. So this is a really important concept to talk about. So what we know about humidity and as it relates to heat is this. So if we look up here and, you know, the weatherman says, okay, the temperature today is going to be 92 degrees. Well, what does that mean for how hot it actually feels to a human body? So if the relative humidity is 80%, what that means is that the body is effectively being exposed to a temperature of 120 degrees. And we know this intuitively, like those hot, sticky days, when it's very, very humid, what happens is that you can't sweat to cool off, right? That's our main way that we cool off as humans. We sweat, right? And when it's that humid out, you can't sweat, right? Because the air is already saturated with water. So what we call this number, this 121 degrees, is called the heat index. And that is what is most relevant or important to human health and how we experience heat and humidity. And we'll get back to that a little later. Okay, so Kiara has been running around Nassau all day, picking her kids up from school, doing all the things. And she goes into premature labor at 30 weeks, okay, during the heat wave. And she delivers at the hospital. Her infant comes out, has kind of low APGAR scores, isn't breathing super well, and ends up going into the intensive care unit. The hospital's overcrowded, lots of patients are coming in, everybody's getting sick. Kiara is very worried, and she senses that the heat wave may have affected her pregnancy, and she wants to know if there's a link. And there is a link. So we know that extreme heat is associated with preterm birth, so being born too early, having a low birth weight, higher risk of having stillbirth, and complications like having high blood pressure during pregnancy, and so on. Kiara is also worried about her kids who are still at home, right? She left them there with her sister. Should she worry? Well, she lives in a very vulnerable place. So she lives in what we call an urban heat island. As I mentioned, when you have sort of buildings that are all built really, really close together, there's no trees, there's no shade. All those buildings are like stones, right? And you know, when you touch a stone after the sun is set and it still feels warm, the same thing happens on a much larger scale when buildings absorb heat during the day. And at nighttime, they radiate back out the heat. So we know that these really dense city environments can be something like 5 to 7 degrees Celsius hotter than outlying areas. So she lives in an urban heat island. So she's experiencing more heat than most people. This might be one of the last slides I show you. So when we think about heat, it's like an iceberg, okay? The tip of the iceberg here are things like heat stroke and heat illness, right? These are the things that we see when there's a heat wave. But underneath that, we see an increased risk of accidents, of trauma, of mental health problems like suicide. We also see issues related to the transmission of diseases carried by food and water, right? Because it's so hot that things spoil. Right? Sick and come. Also can see related structure. All of the is impacting our health. So this is a little bit of a summary slide here. 3 totally different community members, right? Impacted by heat for very different reasons. So we got to be thinking about every person really as an individual when it comes to heat. Good thing there's something we can do to prevent heat illness. So everyone on site, we have are on site. You can grab the handouts and take a look. These are some things that you can do to prevent heat illness. And these are things that you can tell your friends, you can tell your grandmother, you can tell everybody you know how to stay cool. And many of these things you probably know, but you got to do them all together. You got to cool your living spaces with fans or air conditioning, keep the curtains closed during the day. Think about limiting your drink more water, wear lightweight clothing. If you feel like you're getting hot, take a cool shower or bath, and then monitor for signs of heat illness, especially among the people you're with who might be vulnerable. If you do live alone or you think somebody might be vulnerable, have an emergency contact, right? So you're checking in with that person throughout the day, making sure they're okay if it's one of those really hot days. Think about checking on your neighbors, calling your friends, calling your grandma. How you doing? Are you coping with the heat? Okay. What can health professionals do? Tons of nurses here, tons of docs here. First thing you got to do is you got to know your local conditions. If you think it's hot out, check what the heat index is. That's what people in your community are being exposed to. And then add another 5 degrees Celsius for people living in urban heat islands. Know which of your patients are vulnerable and counsel them, right? Counsel them to look for signs of heat illness and counsel them how they can cool off. Work within your facility to be heat ready, right? If you had a heat stroke patient came in, how quickly could you cool them? Where are those resources located in your facility? You need to know this so you can act quickly. And then the best thing that we can do is really prepare for this. We got to counsel our patients before heat waves, right? Just so they know. As we're getting into the hot summer seasons, we've got to be telling our patients that they could be at risk of heat illness. So that's what I've got for you